This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today I'm going to talk about how to avoid carpal tunnel surgery. Um, Carpal tunnel surgery is one of the most common hand surgeries that's done, probably one of the most common surgeries in the country. And basically what it involves is making an incision in your hand. They can either make an incision like this or you can do it endoscopically. And you cut this ligament called the transverse carpal ligament, which frees up space to the nerve underneath, and it can relieve the symptoms in your hand. But let's say you've been to the doctor and they're telling you need this surgery. Well, do you really need it, or what is kind of the course of action? So if that nerve has been pressed on for a really long time, what can start to happen is your hand will start to atrophy and you can lose the muscle mass around your thumb. And at that point, the damage is kind of irreversible. So at that point, it's really recommended to, if you're at that point, to get the surgery and to not try and avoid it. I mean, usually when people get to that point, they've had a numb hand for a really long period of time, and they usually ignore it on the order of years. But let's say you're not there yet and you just get some hand tingling. The first thing that you want to do is wear a splint at night. And what this is you can buy a carpal tunnel splint from Walgreens or Amazon or Walmart, and there should be a hard part on it. Now you want the hard part to go in the front of the wrist, and you sleep with it. The reason why you sleep with it is that most people, when they sleep, they do this with their wrist and it pushes on that nerve. So the splint allows you to do this and allows the nerve to rest. That's really the first line of treatment, and sometimes that's all you need to get the tingling better and to get rid of that night pain. And sometimes that's all you need. Other things you can do, there's certain exercises you could do called carpal tunnel nerve gliding exercises. It's a lot of hand sort of movements like this, and that'll help the nerve glide, because you've got to remember there's a lot of tendons that are around the nerve. So that can help as well. And some gentle stretching also included in that. Other things you can do is sometimes you can do a steroid injection. Again, that's more of a temporary solution, although for some people it does help them out significantly. But by and large, what you want to do is, if you're saying, I don't want to go to the doctor, I think I have carpal tunnel, let me see if I can't do something at home, I'd buy a splint, I'd wear it only at night, you don't have to wear it during the day, and then I would start doing nerve gliding exercises. And between those two, if you have a mild case of carpal tunnel, it can actually go away. That being said, like I said before, if you've got a moderate to severe or severe case, then likely those things will make it feel better but won't help all the way, and the surgery is probably something you do want to consider. And of all the surgeries to get, it's a pretty minor surgery, although it is still surgery. So I hope I answered your questions on how to avoid carpal tunnel surgery. If you have any questions I didn't answer, feel free to leave them in the comments below. But know that I can't respond to your specific medical condition over YouTube. If you like this video, we put out new content every week, so please like and subscribe, and thanks for watching.